So when we have a patient that comes in with low back pain and we've identified that their spine is not moving well, we're going to take an outside-in approach. So the first thing we want to do is address this lumbodorsal fascia. So lumbodorsal fascia is very much misunderstood, right? It sits between the skin and it basically wraps around the muscle. So we use our specialized tool to not only evaluate but then treat. A common problem is people will just lay you down in a neutral position with the tissues not on tension, and they're just going to scrape in there really deep and leave nice red marks, not necessarily in a therapeutic way. So what we do that's different is we're going to have you in a nice tension position. So now if there's any problem with that fascia, it's on tension, and now we recognize that this doesn't really treat deep tissues. It's only going to get the fascia. So as I'm going through here, I'm feeling, right, because this is metal. If it's nice healthy tissue, I come right through and it's nice and easy, it's smooth. But what we're finding here with Brett is that there's some sticky stuff in here, right? It feels like sandpaper underneath there for him. So again, I'm not pushing this really deep. I'm staying in this nice superficial layer. And as I'm going through and feeling the sandy stuff, as I go over rep by rep, we're feeling that stuff decrease. So not only do we check the fascia, there's also a ligament that runs up and down your spine, and we're going to find, we found some right there. So we're just going to go ahead and treat that. Good. That's a good healthy spot. Good. And then very much like our test, right? Our test showed that up here he was nice and round. We're not getting so much of that grit up here, right? None of that. The patient's not feeling any of that grit, neither am I. Now as I come down on this side, right, we get a little bit more of that grit again, and again that aligns with our test that we found that he's not flexing down low here.